Osborne lost more than 42 pounds using Ozempic, but some people have been jarred by the sight of her lost more than 42 pounds using Ozempic, but some people have been to not have that happen if you suddenly lose all this weight. Our medical contributor, Dr. Michael Daignault, joins me now with more on that. I've been hosting TMZ Live. This feels like this could be a segment on that show, but there we go, baby. Yep. But it's a thing. There's a lot of people that are using Ozempic. We've seen what it does to some people's faces, and it's not good.
Right, yeah, it's a loss of the facial muscle volume, that like sagginess, the hollowness that you see, and it's very concerning. And I think, we're still in new territory with Ozempic. We know that it works for weight loss, but some suggestions I have for people if you're thinking about doing this. Currently, the protocol for Ozempic is you start at 0.25 milligrams per week. That's one shot per week, and you do that for a month, and then you go to 0.5 and then 1, etc. I would say you need to slow that down.
Okay.
Stay on the 0.25 longer, see how it goes. Maybe do extended interval dosing. Don't take it every week. Because if you start losing more than 2 pounds a week, that's too rapid.
Okay.
And your body's not going to be able to keep up. You're going to see that, the sagginess and the loss of the volume.
Yeah, I mean, we were just looking at an AI image. This is a real image of Sharon Osbourne. Like, what happened here?
Yeah, this is just the loss of the volume. It was probably, the typical protocol where, it just happened too fast. And, it's really important that if you're going to do this, think about extending the interval, doing a less amount of dose. It's really important to keep up your protein and your collagen in particular. Try to eat, if you're about 150 pounds, that's 100 grams of protein per day. Other suggestions that I have here, hydrate skin plumping products. So in particular, hyaluronic acid is a really good facial cream to use at night to increase the volume and the hydration of your skin. Retinoids, like tretinoin, do that a couple times a week. And then worst case scenario, if you need skin tightening treatments, that would be filler and radiotherapy and microneedling. But I think the key point is prevent it from happening.
And you're in the ER every week. What are you seeing when it comes to Ozempic? Yeah,
so unfortunately, we discussed earlier, seeing a lot of patients that come in with severe abdominal pain. And so now it's just become part of the protocol to ask, are you on a GLP-1 drug like Ozempic, Wegovy, Mounjaro? Because what we're seeing on CAT scans in people with severe abdominal pain is something called ileus. And that means that it's the progression of food through your digestion is slowed down significant to cause stomach paralysis or intestinal paralysis.
Wow. So a reminder, maybe there isn't a miracle drug. Sometimes it's always diet, exercise, getting sleep, the old-fashioned way, which isn't quite as fun, but sometimes more effective. Okay, let's talk about seasonal allergies, something else you're seeing these days, right?
Right, so we really have to be prepared for a pretty bad seasonal allergy season, and that's because we had a warmer winter, so the pollen was released a little bit earlier, and so we can expect to see a earlier and longer seasonal allergy symptom.
It's not good for people that
season, unfortunately. And also, extreme weather events like the high winds that we've had to disperse the pollen over a larger amount of area, and also increased, warmth in the air, global warming. Studies have shown that increased CO2 causes an increase of pollen by 30%. So we're definitely seeing that. But there are some great treatments on the horizon, and we have a list up here. The one that I really thought was interesting was the sublingual immunotherapy tablets. So these are dissolvable tablets that contain a small amount of the allergen, so pollen, ragwood, whatever, and it basically retrains your immune system to not overreact when it gets exposed to pollen. Biological therapies, so these are monoclonal antibodies like Dupixent, which target IgE, which is the immunoglobulin responsible for allergic reactions. Intranasal antihistamine corticosteroid combo. So this is Realtris. I'm really excited about this because everybody knows about Flonase, which is a nasal steroid, but this one actually has an antihistamine like Benadryl in it. There's also some great wearable devices right now, one of which is Plume Labs. It's pretty popular. It tells you, in your area how much pollen there is. It tracks your response to that pollen, which I think is really good. And then, probiotics. There's always, the lactobacillus in probiotics in particular, we think is a potential trigger for allergic reactions, seasonal allergies.
When you say wearable device, is that like an app on your phone, or what is that?
No, like a Whoop watch or like like an Apple Watch or something like that. Yeah.
Okay, interesting. All right, Dr. D, good stuff.
Thank you.
Not a convincing case for Ozempic, but to each their own.
That's right.
Really helps some people, though.
Absolutely.
If you have a question for Dr. D, you can send us an email to askthedoctor@fox.com or hit him up on social media.